Okay, so we are 24 hours post-op, and I have my ice machine on. Um, I have my hand in a brace with a wrap on, and of course, I've now developed a, I don't think you can see it, but like a blister on my thumb. The nerve block wore off around 9 p.m. last night. Um, I tried sleeping in the bed and I couldn't, so I switched to the recliner, which helped, but the pain is just unbearable. Um, my rotator cuff was not torn, thank goodness, but they did relocate the bicep. He said it had a very large bone spur, so he shaved that down and removed the bursa sac to help with the nerve impingement or decompress the nerve. And then they fixed the wrist tendonitis. I have on, let's see, I have on these compression stockings. I have to keep these on until I go back to the doctor in 11 days. I'm not allowed to shower, but I can, like sponge bathe and whatnot until then, and I have to keep my arm in the sling. I was able to put my shirt on, and my husband helped me put my bra on this morning. Um, the Razorback bra really helped because it's not touching the bandages at all, and my shoulders are all wrapped up in a big old bandage, so that has to stay on as well. Sorry for the lighting; it's terrible. Um, let's see what else. Um, they've increased my pain medicine, so I'm taking 2 Percocets every 3 hours. Toradol, which is like a really strong anti-inflammatory, which is a wonderful medication. Taking that every 6 hours, and then they just called me in a muscle relaxant, um, and that's probably every like 4 to 6 or so. So my husband will go and pick that up. They were just gonna do not a full intubation. It was just gonna be like an LMA tube, but because I have really bad reflux, they went ahead and um, did a full ET intubation. Surgery itself lasted, I think it was 2.5 hours. Um, and other than that, I've just really been kind of, our couch like reclines. So I've just been sitting on the couch, reclining for the most part. And then every hour or so, I've been getting up, walking around to get the blood flowing through my legs. One thing I did notice, well, a few things, was right after surgery, I came out for surgery and both of my calves are really, really sore. And they said that's because they think it's because you're in the beach chair position, so you're sitting up, I guess, with like your legs dangling, or not dangling, but legs bent for that extended time, and you're not moving them. So that's probably why my calves are super sore. I do not believe that I have a DVT or anything because it's bilateral calves. It's not just one. Um, my throat is sore from the tube, but that's to be expected. And then the other thing that when I woke up from surgery, I had a lot of burning under my, like in my armpit, almost like I shaved with a super dull razor, like a really bad razor burn. And the anesthesiologist came back in and said, he took a look, and he said that the incision for the bicep tendinosus, um, I guess the cut is lower than where the block went. So the burning pain I was feeling was the actual surgical pain. Um, but other than that, I have my arm. I'm allowed to move my elbow, which is nice. I have it kind of trying to sit out straight as much as I can. Um, and instead of just like, oh goodness, this hurts. Instead of just constantly up here. So I'm just trying to stretch out that elbow. I have to keep my shoulder immobilized. Other than that, day one post op, pain level 8 or 9 out of 10. It's more of like a sharp, burning, shooting pain that comes and goes. Any movement hurts. Um, and my incisions are starting to itch underneath, but I have a dressing on, so I can't get to it. Um, love the fact that I have this ice machine. This has really been wonderful. I made sure to not keep it on all the time yesterday because I did have the block, and so I didn't want to develop any frostbite, which is a possibility, that can happen. So I made sure to constantly, turn it off like 2 or 3 times yesterday. Um, Other than that, I'm just kind of sitting and sleeping and all that. So day one post op. Here we go. I will check in again, I guess, tomorrow for day two, or tonight, or I don't know, whenever. Oh, my eyes. If you can tell, I'm straining to raise them. Um, I developed, I guess it's called like Horner's syndrome or something like that. When I had my block done yesterday, it caused my right eye, because it's the right shoulder, to get like completely, um, like bloodshot, and it was teary, and it's like lowered my lids. And he said that's just from how the block has kind of hit some of the facial nerves, and that should go away. So that's why my eyes kind of look the way they do right now. But hopefully that will dissipate soon. So yeah. All right. Well, this is kind of where we're at, and we'll give another checkup in a while. Thanks. Bye.